Instructions. The listening test is 45 minutes. There are tasks in the two parts of the listening test. Each task consists of a recorded video or audio scenario. The number of questions for each task also varies depending on the length of the video or audio. There are multiple choice questions for some listening tasks and shift-to-shift report for others. After you have completed all the tasks in the listening section, you may have some time remaining. You can use this time to navigate back to previous tasks to check your answers. Now get ready for the test and follow the instructions. Part 1. Tasks 1 to 4 instructions. You will listen to a short audio or video recorded conversation and answer the questions. While listening, select the correct answer from the options provided for each question. Task 1. Booking a follow-up appointment. You will hear a telephone dialogue between medical office assistant and the patient. You will get 45 seconds to read the questions. Listen to the recording and select your answers.
Dr. Carter's office.
Yes, I'd like to make an appointment to see Dr. Carter, please.
Is this your first visit?
Yes, it is.
Okay. Could I have your name, please?
Yes, my name is Ronald Schuler.
And may I ask who referred you to our office?
I drove past your office yesterday.
Okay. How about the day after tomorrow on Wednesday at 4 o'clock?
Do you happen to have an opening in the morning? I usually pick up my kids from school around that time.
Okay. How about Tuesday at 8 a.m. or Thursday at 8:15 a.m.?
Do you have anything earlier, like 7:30?
No, I'm sorry.
Well, in that case, Thursday would be fine.
Okay. Could I have your phone number, please?
It's 643-0547.
All right. And what's the nature of your visit? Yes, sir.
Well, to tell the truth, I fell from a ladder 2 days ago while painting my house, and I sprained my ankle when my foot landed in a paint can. I suffered a few scratches on my hands and knees, but I'm most concerned that the swelling in my ankle hasn't gone down yet.
Well, did you put ice on it immediately after this happened?
Well, yeah, I just filled the paint can with ice and...
And so after you removed the paint can... Sir? Sir, Mr. Schuler, are you still there?
Well, that's part of the problem. The paint can is still on my foot.
Look, Mr. Schuler, please come in today. I don't think your case can wait.
You will now have 45 seconds to review your answers.
Task 2. Patient injury. You will watch a dialogue between nurse and patient in a video scenario. You will get 45 seconds to read the questions. Listen to the recording and select your answers.
Hello, good morning, nurse.
Good morning. Yes, Miss Judith. What happened? How did you cut your foot?
I went to the beach with some friends and walked a bit too close to the rocks. I slipped on a rock and cut my foot.
I see. When did you cut yourself? I mean, when was this incident?
I slipped over yesterday morning. It was just before lunchtime.
I see. So it happened a day ago?
Yes. I cleaned the cut in salt water and covered it with a small dressing. I thought it would be okay. When I woke up this morning, my toe was red and very sore. I am worried because I have diabetes.
It was good that you came to hospital today. Cuts and wounds can be dangerous for diabetics.
I know. I try to be very careful with my feet. I'm also worried about amputation. I don't want to lose my toe.
Amputations are only needed if a diabetic infection doesn't heal properly.
Oh, okay, I see. What do I have to do now?
First, I'll give you some IV antibiotics to clear up any infection. The antibiotics are very strong, so they have to go through your vein. That means that they get into your bloodstream more quickly.
How long will I have to have antibiotics?
Only for a couple of days. I'll also clean the cut and put on a clean dressing. You should be careful when you are walking.
Okay. I have to change the dressing myself.
You can do it yourself, or come to the clinic every day.
I think it would be better to come to the clinic each day.
All right. I'll make an appointment for you.
Thank you, nurse.
You will now have 45 seconds to review your answers.
Task 3. Patient Status Report. You will hear a dialogue between a nurse and a nursing assistant. You will get 45 seconds to read the questions. Listen to the recording and select your answers.
Hello.
Hello. Is this Amelia, nursing assistant?
Yes, speaking.
This is Ellie, the nurse from Hopewell Hospital. I just want to know the health status of Mrs. Jamie. How's Mrs. Jamie today? Has she had any falls?
She's fine today, but she did have a fall last night. Fortunately, it was only a small fall.
Oh, that's not good.
She took a laxative yesterday and was worried that she couldn't get to the toilet in time.
That must have been difficult for her.
She takes a lot of care with her personal hygiene.
Yes, I know. She does.
Unfortunately, she woke up in the middle of the night and couldn't see very well.
Was her night light put on last night?
No, I don't think it was put on last night.
I see. Well, it's very important that his night light is left on every night as her vision is poor.
Yes, I will ask the night staff to check her night light tonight.
I think that she is still wearing his old slippers at night. They are not safe at all.
Okay. I'll talk to her and explain that her slippers may make her trip over.
What about her call bell? Does she use it all the time?
I don't think so. She often seems to leave it in her locker.
But it's important that she keeps it with her at all times. She's quite unsteady on her feet and needs a bit of help. Could you talk to her about it?
Yes, she believes me, and she understands the things that I advise her. I might be able to explain how important it is to ask for help.
That would be great. Take care.
All right. You will now have 45 seconds to review your answers.
Task 4. Answering the queries. You will watch a dialogue between nurse and patient in a video scenario. You will get 45 seconds to read the questions. Listen to the recording and select your answers. Good morning, nurse.
Good morning. How are you, ma'am?
I'm having a hysterectomy tomorrow, but I don't really know much about it.
That's okay. I'll go through it with you now. What do you already know about the operation?
Well, I've got fibroids and I've had a lot of problems with heavy bleeding. Heavy periods, bleeding. Heavy periods, I'm a teacher and it's really affected my work. I've had a lot of time off work because of it. I know I am having my uterus removed, but I'm not sure how the operation is done.
You're having a laparoscopic hysterectomy. The hysterectomy part means the removal of the uterus, as you already know. The operation will be performed as laparoscopic surgery. This means that you won't have a large cut made into your abdomen.
I'm still not sure I understand how the surgeon can remove the uterus.
The surgeon inserts a laparoscope into one of the incisions. This is to have a good view of your internal organs. Then, surgical instruments are inserted into the other incisions so that your uterus can be removed.
Okay. I understand now. What about afterward?
You'll stay in hospital for a day or so until you are ready to go home.
How long does it take to recover from the surgery?
Recovery time after a laparoscopic hysterectomy is shorter than for an abdominal hysterectomy. However, you'll find it can take up to 2 months to fully recover. You should make sure that you rest every day and avoid heavy lifting during this time.
Okay. Is there anything else I should be aware of?
Yes. After surgery, some women find that their bowel habits change a bit and they become constipated. It's important that you don't strain when you go to the toilet, especially soon after the operation. You may need to take a laxative to prevent this.
All right. I'll keep an eye on that.
After the operation, you'll have some vaginal bleeding, like a period. It may last up to 6 weeks.
What about driving? How soon can I drive my car again?
You shouldn't drive your car until you can comfortably wear a seatbelt and can perform an emergency stop. Most women find they can return to driving from 3 to 8 weeks after their hysterectomy.
All right. I'll see how I go then. Having fibroids has caused a lot of pain and I certainly am looking forward to not having heavy periods anymore.
I can imagine that it must have been extremely difficult. I think I've covered everything you wanted to know. Did you have any other queries about your surgery?
I don't think so. Now I understand what will happen tomorrow and how I need to look after myself after the operation.
Great. If you think of anything else, you can ask me anytime. You will now have 45 seconds to review your answers.
Part 2. Tasks 5 Instructions. Listen to the report and dialogue and circle the correct answers as you listen. Task 5. Shift-to-shift report. As you listen to the shift-to-shift report, circle the best choice for each room and patient. You will get 45 seconds to read the questions on the chart before the audio begins. Listen to the recording and select your answers.
This is the evening shift report for Monday, June 3rd. Room 108. Mr. James is doing well now. You'll notice a big improvement for last 2 days. He has started walking now. Now he need no extra support to get to the toilet in time. Room 106, Ms. Kate, is doing well. Doing well. She had the fever yesterday, but now her temperature is down to the normal. And today she complained about the weakness. She is advised to have fresh fruit juice daily. She is very cheerful person and often cooperate with the staff. Now, room 109. Mr. Kevin has admitted today morning. He has lung infection, breathing difficulty. Oral steroids are given for some relief. Now he is feeling better. Further, some tests would be conducted tomorrow. Then room 113, Mr. Andrew. His condition is much better now. His wounds are healing now. He is very happy about his fast recovery. He needs dressing evening. Also room 126, Mr. George. His dosage of diabetes has changed. He's now on 500 milligrams metformin. The insulin injections has stopped now. His diabetes is now under control. His blood pressure is also under control. He seems to be feeling better and may be discharged soon. Okay. Room 128, Ms. Joshua. Has a lot of visitors often, and having a network of supportive people is very beneficial for her health. She gets enough sleep now. And she has now started eating well. Room 132, Mr. Joseph. He is not in a good condition. He has cough or hoarseness that does not go away. Medications are given today morning and waiting for the result now. Further, some tests had also done for the reason behind it. Report will come tomorrow morning. Well, I think that's all to report for now. Hope you have a good night. Talk to you later.
You will now have 45 seconds to review your answers.